Hello everyone, this is one of our favorite patients, Peter, and he's been kind enough to allow us today to show the technology that we use in placing implants with guided surgery, where we do not have to make any incisions and you really receive no stitches. Rarely do you have any discomfort that requires anything stronger than some Advil. So let's begin. First we start by taking digital impressions of Peter's mouth in the area that we're going to place an implant. Right now I'm showing you the little insert that is a key to guided surgery. This insert is designed off of me designing where the ideal crown is going to be for Peter and then working backwards to import this information into our 3D CAT scans. So right now we're going to go to a different screen. So we originally started with the scan on our CEREC machine, which is a digital CAD/CAM precision piece of equipment that allows me to take digital impressions for crowns and bridges and veneers without having to put the typical gooey stuff in your mouth that you have to sit and wait for 5 minutes before it's ready to take out. So we've taken a scan of the arch where tooth number 5 is missing, and we're going to go ahead and proceed to show you the proposal that we came up with.
Come back here, say it again.
So here's our prosthetic proposal for tooth number 5. And this is pretty much an ideal plan. Whenever we're doing a dental implant, the final crown is slightly smaller than normal teeth. So we're seeing good alignment of the proposed crown, looking at it from the top. When we look at the crown from the side, we see that it lines up nicely. And when we look, as we turn to the side, we see that it looks excellent in profile. So this information is then imported into our CAT scan, which is called Galileos. Galileos allows us to plan the placement of the implants by importing the data of CEREC into the CAT scan so that I see where that crown is. I'm then able to use the tools in the CAT scan to ideally place the implant so that it fits right underneath where the proposed crown is going to be, and that I have safe spaces away from adjacent teeth. To do the scan first, we had to make a scanning appliance. So we took just a quick little impression of the quadrant of teeth that we're working on, and we poured up in a special material. I then fabricated a special jig, which we put in Peter's mouth, and the jig was fabricated from this little model, and Peter wears that during his scan. After the scan, I then mill a precision little insert that we showed you first in the beginning of the video that goes inside this little scanning appliance and allows me to do guided surgery without any incisions or any stitches necessary. Hi, I'm Dr. Shubin, and this is our great patient Peter, and we're going to show you how we do simple guided surgery for the placement of a dental implant. So, we have our scanning appliance, which we showed you earlier in a video, and we're going to simply place this in Peter's mouth. Simple as that. I'm now going to use a tissue punch to remove a little bit of the gums where the implant is going to go. So I'm simply going to remove the tissue that covers the extraction site. Okay, so we have our precision key in here, and we simply and we're going to go to our next key in just a second. And we're going to remove this and place our implant. Okay, we're now going to place Peter's dental implant.
I can't wait either.
Bye.
Bye.
Just as straightforward as that. We want to rinse it and place a healing button. And that is simple guided surgery. Thank you and take care.